Hello everyone, my name is Pauline Jurczak. I am a hydrogeologist and GIS specialist for groundwater relief. And today I'm going to talk to you about the analysis of groundwater resource management and climate in the Somali region of Ethiopia. Two partners were involved for this project, the MSF Emergency Response Unit. MSF OCA respond to emergencies such as displacements due to drought, floods, and more specifically to the Somali region of Ethiopia. It has a continuous monitoring and surveillance network in place. Groundwater Relief, the UK charity I work for, conduct groundwater exploration and groundwater resource assessment for small community projects to large regional projects across Africa, Asia, the Middle East and Latin America. We are 5 permanent staff and we are supported by a global membership network of groundwater experts who help us in development projects as well as humanitarian projects. Coming back to the project, so we are based in the Somali region of Ethiopia, which is a region that has experienced a severe water crisis over the past 10 years. The effects of this crisis can be seen in repeated water supply failures, triggering crop failures and livestock death, resulting in wide-scale food insecurity emergencies. As a result of these ongoing droughts, 2.9 million people are experiencing extreme hunger only in the Somali region of Ethiopia. The frequent breakdowns in reliable water supply have been highlighted and are still highlighting the pressing needs to investigate the root causes of these failures. And this is why this project happened. So the main objective of this project is to identify the issues, barriers and solutions for water supply in the region. Then once we obtain this first base understanding, we overlay this with epidemiological data from MSF in order to generate maps of high vulnerability, high exposure zones, so that MSF can adapt its response. The way we tackle this objective is by trying to answer 4 main questions. Those 4 main questions were answered remotely, but as well as with in-country work. So the first question really is, what physical and human factors create water scarcity in the Somali region? Before we do anything, like, is there any physical and human factors? And for that we did a desk-based study where we compiled a lot of available data and literature from different stakeholders. Then once we had this base understanding, we moved on to the climate analysis. We used 2 types of climate analysis: the TAMSAT climate analysis, which use recent and historical rainfall event as well as future prediction. And we also used the GRACE model, which examined the groundwater recharge and the storage variations in the first centimeters of the ground. So the 2 questions related to climate change itself that we tried to answer was, how is climate change impacting the Somali region and how will it change in the future? And the second one was how this affects the population. Following this study, we worked with Professor Seifu Kebede, who went in the Somali region of Ethiopia and discussed with a lot of stakeholders from regional level, ministry level, but also international NGOs, to gain an understanding through semi-structures interviews on the current water supply situation, the current water management practices, the gaps, the concerns of people, and also try to obtain the data from the data gaps that we identified during the desk study. So talking about the results, we're going to go through them by questions that we tried to answer. So the first one was, what physical and human factors create water scarcity in the Somali region? So for that, we overlaid physical factors such as aquifer productivity, knowing that the main hydrological units in the Somali region include sedimentary, alluvial, and volcanic rocks. They all serve as aquifer, but the water is mainly stored in the alluvial deposits. There is a great potential for deeper aquifers, but it needs to be fully explored still. We looked at aquifer quality with a big problematic around water salinity in this region. We looked at the hydrology, looking at the perennial rivers. There is only 2 perennial rivers in the Somali region. We looked at the agriculture. Where are the soil favorable to agriculture if the irrigation is in place? The recharge mechanisms, and we overlaid that with human factors that we had at the desk studied stage, which were the geographical shift of the IDP's population, to understand where this population were coming from and where they were willing to settle down. And that provided us with a base understanding of the area prone to water scarcity. Following this, we did the climate analysis. And this is where really a careful interpretation is required in terms of the implication for water security, because the rainfall, the TAMSAT climate estimates were showing that the rainfall is increasing, but it's also likely to be accompanied by a continued increase in variability and extremes. So rainfall increasing presents an opportunity for engineering solutions such as artificial recharge channels and sand dams to capture the increased rainfall. However, the rainy season pattern will become way more variable, both year to year and within the same year, which can lead to extreme events such as droughts and flash floods. We have seen a similar increase in evaporation potential, which results in less available surface water from rainfall to recharge the aquifers. And finally, the temperature will rise, leading to more intense flooding and increasing the risk to humans and the environment. That was from the TAMSAT climate analysis. The GRACE model gave a similar response because in response to the increased annual rainfall, there is a long-term trend of increased groundwater storage. But in the same way, it's becoming more variable and responsive to seasonal rainfall patterns. We managed to, so as I said, TAMSAT looked at past events and is able to predict future events based on historical trends. However, groundwater storage through the GRACE model is not something that we can project because it's too much linked to all the stress that are applied to the aquifer, such as the new irrigation scheme, the urban areas developing where the IDP camps are established, etc. So, the storage was not projected in the future. We tried to answer question 3 and 4, how climate change and population pressure is affecting groundwater availability. And this is where the interviews from Professor Seifu Kebede came in the game, and that was really interesting. And there were a lot of information drawn out from these interviews, but the main two are the emergency food insecurity that is created by this water scarcity situation because of the failure of crops continuously and the water resources, forcing sale of assets and personal displacement. And there is a map here on the right hand side about the food insecurity. And also the cash transfer programs or cash injections, which are now widely encouraged in drought emergency responses, are a new way. It's injecting cash flow availability, and that has changed water users' practices, such as pastoralist and settled communities that were before using birkas and wells to have water, and now only using water tracking. So answering those 4 questions really provided us with an overview of the situation in country. This was really useful to MSF, which put in place practical solutions. They, for instance, proposition resources for extreme climate events, such as such as hygiene kit, cholera response preparedness, malnutrition preparedness, displacement preparedness. What has been really useful was that they were able to map hotspots of vulnerable areas. Based on the map that we produced, they mapped on top of that the epidemiological data and health data, and that gave them a map of hotspots that works as an early warning tool, because the data that they are mapping, because the data that we provided are kind of static, but the data they are mapping on top of it, the epidemiological data, rainfall data, are dynamic, and they are able to provide a tool to forecast response and to prepare better the response from them. They also put in place practical outputs such as portable reverse osmosis tool. So those portable osmosis tools are meant for food preparation for infants. They are there is a picture on the left hand side of the size of it, so it can't produce water for a whole population, but it can produce about 300 liters a day for food preparation. So they've been able to provide that in the area, in the area where of those hotspots. So what's next, really? MSF is continuously advocating for sustainable water development of groundwater resources and trying to find tools to the water scarcity situation in the region. They keep updating the hotspot map with climate data and epidemiological data, and the future is also capacity building of the government and handovering these tools so that they can also beneficiate from it. So I hope that presentation interested you and that you've got a lot of questions. Thank you very much.